sang Dios iyagid nga humanon. Ini ang 1233 DYVS. Nagawaragwag sang maayong balita sa tunga ka siglo.
Kaupod sa kalamidad kag sa katawhayan,
Kadampig mo,
kaunungan sa hustisya kag sa kaalam.
kadampig mo,
Abyan mo sa ikaayong hunahuna.
kadampig mo.
Ari na ang
Kadampig Mo.
Great morning sa inyong tanan. Ali naman kita subong sa Friday edition sang Kadampig Mo. And this is Dr. Pauline Tan ngo. Suso, totoy, dodo, dughan, or breast in English. Ang breast can represent fertility, femininity, or abundance. And actually, prominent din siya sa perception sang isa ka lawas sang babae, and as well as sexual attractiveness. The breast, especially the nipples, can be an erogenous zone. And in Proverbs 5:19 to 23, it says, "Always let her breast satisfy you. Always be intoxicated with her love. Why should you, my son, be intoxicated with an adulterous woman and fondle a loose woman's breast? Each person's ways are clearly seen by the Lord, and He surveys all his actions." So you can see that the breast is a representation sang sexuality. And of course, if, for example, the breast incurred an illness like breast cancer, it is tantamount to a very disastrous diagnosis sa isa ka babae. So why am I saying this? It's because October is Breast Cancer Awareness Month. So ano gid bala ang breast cancer? Breast cancer, of course, they occur almost entirely sa mga kababaihan. Pero ang mga lalaki, maka-breast cancer man sila. And cancer starts when cells begin to grow out of control. So, importante gina, no, nga mabalaan kung ano ni siya ang awareness mula sa breast cancer. It's important nga maintindihan man naton nga kung may nahikapan ka sa tutoy or sa dughan, pwede man na siya nga benign and not malignant or cancerous. Non-cancer nga breast tumor, they are considered abnormal man nga pagtubo, abnormal growth. Pero wala na sila nagalapta outside the breast, kang hindi ni siya delikado. Pero sometimes types of benign nga breast lumps naga-increase gid man sang risko sang isa ka babae para mag-breast cancer gid. Therefore, kung may nahikapan gani nga bukol sa tutoy or sa dudo or sa dughan, kinahanglanon gid mapa-check up sa isa ka healthcare professional para mahibalaan kung ang ini siya benign o kung malignant, because it might affect your future cancer risk. So, just as the introduction ng bala, no, ang breast cancer pwede gina siya ka start sa different parts sang breast. And the breast actually is an organ nga nagatungtong sa upper ribs naton kag chest muscle. May ara sang left, may ara sang right. And kada breast may ara sang glands, duct, kag fatty tissues. So what is even more important on top of being a sexual representation or sexual secondary characteristic, ang breast nagahimo kag nagadeliver sang gatas para maka-feed sa newborn and infants. So you see, the breast is a very important part of a woman's anatomy, not just for a sexual expression or characteristic, but it provides life-sustaining milk for the offspring of the woman. Maka-feed siya sa newborn and infant. Ang amount naman niya sang fatty tissues, amo naman na siya ga-determine kung ano kadako sang breast. So just as trivia, whether gamay ang breast or dako, pwede gid ka breastfeed. And you don't have to have big breasts in order to produce enough milk para sa baby. So, i-review ta kay ang breast may ara sang different ka mga part. Number 1, lobules. Ano na siyang lobules? Ang lobules, glands na siyang amo na ang kahimo sa gatas. That is the gland that make breast milk. So, kung ang cancer nagsugod diri, they are called lobular cancer. Ang ducts naman, gamay na siyang alagyan o kung kanal nga halin sa lobule, ginadala niya ang gatas pakadto sa nipple. This is the most common gid nga lugar for breast cancer to start. So, ang cancer nga nagsugod diri are called ductal cancer. So, kabalo na ta, lobular cancer, and the next is ductal cancer. Ano naman yung nipple? So, most probably, you already know kung ano ang nipple. It is the opening sa skin sang breast. So kung diin ang mga ducts nagatilingub kag nagakadto sa larger duct para nga magwa ang gatas sa breast. And the nipple, gin-surrounded na siya sang darker nga kag thicker nga skin which is called areola o kun utong. So pwede man na nga dira maapektuhan ang breast cancer, and this is called Paget disease of the breast. So, amo ginaya ang more common, lobule, duct, nipple, lobular cancer, ang pinaka-common ductal cancer. So, ang fat kag connective tissue nga naga-surround sa duct kag lobule, kag amo ni siya ang make sure nga in place ang mga duct and lobule, no, pwede man da nga dira mahalin ang tumor, pero less common. Ang blood vessel, pwede man nga mag-tumor. Angiosarcoma naman niya. Okay. So, klaro na ta. So, paano mag-spread ang breast cancer? It can spread when the cancer cells maglapta sa dugo or lymph system kag idala na siya sa other parts of the body. Because ang lymphatic system, part na siya sa immune system. Daw network na siya, no? Daw network na siya sa lymph nodes, ducts kag vessel, and they work together para nga dalon na ang lymph fluid from body tissue pakadto sa blood. Ang lymph fluid inside sa lymph vessel, they contain tissue byproduct kag mga sagbot bala. They also contain immune system cells. So dalon niya na ang mga higko, ang mga fluid halin sa breast. Pero in the case ng breast cancer, the cancer cells makasulod na siya sa lymph vessel and malaptan na siya sa aton nga lymph node. So diin ang aton nga mga lymph node or lisay. Lisay nang tawag naton, no? Pwede na ang lisay makita sa ilok, amo na ang axillary lymph node. Ara na siya sa ilok. Lymph node lapit sa breastbone. May bone ta na, ang tawag ta na internal mammary lymph nodes. May ara pa gid ang lymph node sa babaw sang aton nga collarbone kag below the collarbone. Amo naman na ginatawag naton nga supraclavicular. Kay clavicle na ang collarbone, ang tawag ta na clavicle. So kung supraclavicular, above the collarbone. Kung infraclavicular, below the collarbone naman. So, as you see, ang cancer cells pwede na maglapta sa lymph node kag dako gid ang tsansa nga kung nala na sila sa lymph node, malapta pa gina siya sa iba nga part sang body. Okay. So, natandog ta na ang topic ko kung di na nagtubo ang aton nga cancer. So, ang subong, ang gusto naton maintindi, ano ni siya ang mga risgo sang aton nga cancer, breast cancer risk and prevention. So, ano na siya ang risk factors to begin with? It is anything nga ga-increase ang chances of getting a disease such as a cancer. So, kung damo yung mga risk factor, hindi man necessarily ginamin nga makuha gina ang ina nga sakit. There are risk factors like family history, aging, no, nga hindi mo na makontrol. Pero may mga risk factors man nga pwede mo makontrol, no? So you can be sure that ang aton nga lifestyle dako gina iya nga kwan, dako gina iya nga factor. So for example, kung sige ka sang inom sang alcohol, pwede gina mag-increase ang risk sang cancer. Also, being overweight or obese and not being physically active. Kag kung wala ka sang bata, no, kag wala ka ga breastfeed, it puts you also at risk. And some people nga naga-birth control, ga-use na sila sang hormone, it will increase breast cancer risk. Kaya nakita ta na nga ang oral contraceptive, amo na ang birth control pills, has a higher risk of breast cancer as compared to the women nga wala nagagamit. Once nauntat na ang pills for contraception, naganubo man na ang risgo within 10 years. So also may hara na sang mga injection, no, nga like Depo-Provera every 3 months sa injection as a birth control. It also increase breast cancer risk, as well as birth control implants, IUD, skin patches, vaginal ring. And for women who are in their menopausal age and they are taking hormone therapy, pwede gina siya mag-increase man. So, there are 2 main types ng hormone therapy. Kung may ara ka pa sang mattress or womb, usually ang doktor nag-prescribe sang estrogen and progesterone. Combine na siya ng hormone therapy. Ang progesterone kinahanglanon gina because estrogen lang, it can increase the risk of cancer. Pero kung wala ka na sang mattress, naka-hysterectomy ka na, pwede nang gamiton nga estrogen alone. So, amo na naman ang ginatawag natin nga estrogen replacement therapy. So, at least may nabalaan kita. How about ang breast implants naman? Wala na yan na link ya sa increased risk of the common type ng cancer, no? Pero of course, because breast implants, they are foreign bodies. So, may iba naman niya nga pwede matabo. So, for example, rare man nga case na may associated sa breast implant associated anaplastic large cell lymphoma and other lymphomas. So, pwede gid, pero not that frequent. Okay, let's just have a short break.
Our heartfelt gratitude to you, our ministry partners, for your generosity as we fulfill our mission of communicating Christ in our world. If you are being led by the Lord to continue helping 1233 DYBS, you may send your support to our China Bank account with account name Far East Broadcasting Company Philippines Incorporated and account number 18707315111. Again, the account name is Far East Broadcasting Company Philippines Incorporated with account number 18707315111. For inquiries, you may also call Rose Hamelo at telephone number 444-2112.
We are now on the second half of Kadampig Mo Friday edition. Kag ang topic naton is about breast cancer awareness. And I'd like to share with you ano ang mga signs and symptoms sang breast cancer. Actually, most people, hindi sila maka-experience sang any symptom, especially when the cancer is still early. Hence, it is important nga may arat na ginatawag nga early detection. Breast cancer can have combinations ng symptoms, especially when it is more advanced. So number 1, may mahikapan ka nga bukol o kung palang damol. Sometimes wala sang pain or sakit. There is a change sa size, sa shape, kag appearance sa dughan or breast. Makita mo nga naglupyak or ginatawag naton nga dimpling, palamula, or pitting or other changes sa panit, kag may change ang nipple appearance or ang areola. So, pwede na mag-change ang appearance niya. And sometimes may makita nga abnormal or bloody fluid halin sa nipple. So, kung ang isa ka tao nakakapa sang isa ka abnormal breast lump, no, ma-seek dayon sa medical care para matanaw kung ano na siya. Although most breast lumps hindi cancerous, pero breast lumps that are cancerous are most likely matreat na siya successfully, especially kung gamay pa siya kag wala naglapta sa aton nga lymph node. So let me also tell you that ang breast cancer makaspread na siya sa different areas of the body and trigger other symptoms. And oftentimes, ang makita naton nga detectable site sang paglapta, amo na siya ang lisay or lymph node nga sa ara sa ilok. So hindi man na naton makapaan no nga may ala na dagali sang nagabukol nga lymph node. So paano na siya naton ma-detect? So usually bala no ang detection self-examination, pero sometimes hindi naton balaan no kung ina siya ang bukol na tsakto ba na or hindi. So ang permi na ginahambal no nga paano naton ma-detect. So there are imaging tests para mapangitaon na ang breast cancer. But we have to be very wary. The most common nga ginagamit is mammogram. But mammogram as a screening test, and this is my personal opinion, not the opinion of the general standard of care nila, no? Pero many doctors are now becoming aware that there is risk sa mammogram. Pwede na siya nga mag-false positive. Also because kadala na siya sang radiation, pwede man na siya nga mismo makakos sang breast cancer. So, we have to be very careful regarding the mammogram. So, there are other types of screening tests that are considered safer. So, because actually X-ray na siyang mammogram mo, pangitao na siya dayon kung may gamay ka nga bukol. So, isa man nakaklase nga X-ray. So, other types of diagnostic procedure is by using ultrasound. For me, ang ultrasound is safer. Why? because ang aton nga kwan, ang aton nga ultrasound does not have radiation. Wala niya radiation ang breast ultrasound. It uses sound waves and their echoes to make a computer picture of the inside sang breast. So makita na ang breast changes such as kung may ala sang cyst. Ang cyst na siya may fluid sa sulod and ginagamit na siya also as a screening test. So useful man na siya and it is safer. So later on may ara na sang mas bag-o pagid nga mga screening modalities such as breast MRI. Kag may ginatawag nga ang MRI na iya sudlon ka na sa isa ka kwan ka machine kag tan-aw na nila. Breast MRI may sometimes be done kung ginasuspitsa ang breast cancer. Pero ginauna ginaiya ang breast ultrasound. Ang breast ultrasound ginang una. Or sa iban nga mammogram. Pero as I said, ang mammogram, there's a high risk for false positive. At the same time, it is also a risk for developing cancer itself because it is radiation. So, amo nang na nga ako mahambal. So, how about the treatment? Actually, ang treatment sang breast cancer, no, after nga na-determine na nga may ara gid man, ang best gidya no is either you have a surgery, pero these are technical na kaayo, and of course chemotherapy amo nang usual nga gina-offer sang standard of care. But I believe patients should have a choice. There are certain patients na did not respond to chemotherapy or don't want to suffer the consequences and complications of chemotherapy, so they can opt for certain treatment. Right now, there is what is known as ozone med. Ang ozone therapy, pwede na siya nga, it is used in conjunction with surgery in order to repair, to rejuvenate, and to restore ang healthy cells sang cancer. And makita naton nga sa ozone madamo gid nga mga kababaihan, those with breast cancer or even other cancers, they are able to survive. So Dr. Barales, she's actually my mentor, no, Rio Barales. She is a cosmetic surgeon that had breast cancer 17 years ago, but because pag nag-surgery siya, anti siya ng surgery, ang iya nga heartbeat nagloko, nag-ventricular tachycardia siya, so ang surgery na-postpone. And during that time, ginapanumdum niya, basi hindi ni siya para sa akon, nga ventricular tachycardia or VTAC. And at that time, ang iyang husband, si Attorney Roberto Barales, did some research and nakita na ang ozone med. But during that time, 17 years ago, wala sang ozone therapy sa Philippines. So nakadto sila sa US where Doktora had her treatment with ozone therapy, auto hemoperfusion na, no? So kuan na jutay nga dugo, and then ginaimpo na siya sa IV fluid nga ozonated, may ozone, and i-transfuse back sa patient ang ina nga ozone infused fluid together with the blood. So she did that, and until now she is doing that, and she is cancer free, doing very well. And by the grace of God, no, okay gid si doktora, and ang iya tong doctor dito sa US was telling her, why don't you bring ozone therapy to the Philippines? But she was quite hesitant because hindi na iya nga core skills. Actually, Dr. Barales is a cosmetic surgeon, so though hindi iya feel, but God has impressed upon her, and finally in January 2020, just before the pandemic starts. That's the time that Dr. Rio Barales started to have ozone. Nagdala siya sang machine to have this ozone generator para nga mahatag treatment sa mga patients. And when the pandemic strikes, many cancer patients were not able to go to the hospital. So they are looking for other alternatives kag nakita nilang ozone med. And because nga pag-try nila sang ozone, successful gid kaayo nang nami ang pamatsyag niya. So as of now, there are actually 11 na nga branches sang ozone med which was started by the Barales family. So we are thankful because in Bacolod City, there is also an ozone med. So you can look for ozone med sa Facebook man. And you can consider it as an option for treatment on top of the surgery, with or without surgery, and check it out. So what I'm telling you, ako ng mga dear listeners, is that there are other modalities of treatment. And of course, when one is diagnosed to have cancer, it is important na we watch what we are eating. So many times, patients are told nga, sige, you can eat anything but in moderation. But what happens is that the diet bears a big influence on the recovery of a patient. If that patient continued to eat inflammatory food, ultra-processed food, meat or seafood, then most likely the cancer cells will be fed, no? And because these are inflammatory food, so the advice would be to stick to a diet that is full of vegetables and fruits. So vegetables doesn't mean nga utan lang gid nga dahon, no? You can also have legumes, beans, nuts. You can also have root crops like kamote, like taro, like cassava. So you can incorporate into the diet of a cancer patients all the vegetables and fruits. And just be careful because the vegetables sometimes have pesticides, so they need to be washed either with soda, baking soda, or ang aton nga asin, pwede gina. At the same time, no, pwede man ka incorporate sang raw juice. Pwede ka mag-juicing with vegetable juice, no? And of course, there are many food that are healthy, that are whole, no? Hindi lang na iya ang meat because rarely do we have grass-fed meat here. And also, kung poultry naman, ang kakulba naton because the chicken right now grow up to 1 kilo in just 18 days. So they are bombarded with antibiotics and hormones. And how about fish? Ang fish naman niya puno naman sa microplastic kag nanoplastic, and these have been shown to be carcinogenic as well. So many carcinogens all around. And of course, we want to balance ang health sang isa ka cancer patient, making sure nga hindi siya mag-stress and matulog siya temprano, drink more water, have the sun, breathe in air, but even more importantly is to pray to the Lord and focus on God rather than focus on what is happening to her body. I know a woman that experiences or is recently diagnosed to have breast cancer, daw catastrophic na ang news. But do not fear, because when we pray to the Lord, He will give us peace in our heart that transcends all understanding, and He will give us wisdom and direction on the way to go. So that's it. October is Breast Awareness Month, and hopefully na-aware man ta sang importance sang early detection and what to avoid and what to do. Take care, God bless, and see you next Friday.
Ini si Johnny May Camhalbuna of PhilHealth Region